Your kidneys are failing right now, and you feel nothing. No pain, no warning, no signal dramatic enough to make you call anyone. Just a quiet, invisible, relentless deterioration happening in two organs the size of your fists that are responsible for filtering every drop of blood in your body. And your nephrologist, the specialist your doctor sent you to when your kidney function numbers started dropping, looked at your kidneys, measured your creatinine, adjusted your medications, told you to drink more water and eat less protein and come back in 3 months. What your nephrologist almost certainly never did was look up. Look at the organ sitting above your kidneys in the hierarchy of your body that has been sending corrupted instructions to your renal system for years. Your brain, the same brain that after 60 begins to deteriorate in ways that directly compromise kidney function through mechanisms that nephrology appointments are not designed to investigate. Your kidneys are not failing because your kidneys are broken. Your kidneys are failing because the system that regulates, protects, and governs them has been quietly breaking down for years, and the specialist treating your kidneys has never once looked at that system. Today, I am going to show you exactly how your brain controls what happens in your kidneys, what breaks down after 60, and what addressing the brain side of this equation could do for the kidney function your current treatment is failing to protect. My name is Dr. Angela Whitfield. This channel exists to show you what a rushed appointment never will. Everything I share here is for educational purposes only and is not a substitute for professional medical advice. Please speak to your doctor before making any changes. Drop your city or country in the comments right now. I want to know who is watching today. Before I take you through the brain-kidney connection, I need to reinforce the principle that drives everything on this channel, the brain-first principle. Your brain is not just your thinking organ, it is your body's master control system. Every organ, every blood vessel, every hormonal signal, every inflammatory process in your entire body operates under direct or indirect instruction from your brain. When your brain is healthy, those instructions are precise and protective. Your kidneys receive clear signals about how much fluid to retain, how hard to filter, when to activate their protective mechanisms, and when to stand down. When your brain begins to deteriorate after 60, those instructions become corrupted. Signals arrive late. Some do not arrive at all. Others fire continuously when they should be resting. And the result is not a brain symptom. The result is kidney damage, quietly, invisibly. In a person who feels fine and is faithfully attending their nephrology appointments and doing everything they were told to do, while the real cause goes completely unaddressed. Let me tell you about Caroline. Caroline was 71 years old, a retired librarian from Tucson, Arizona, meticulous woman, the kind of person who never missed an appointment, never forgot to take her medication, and kept a detailed health journal that she brought to every doctor's visit. She had been diagnosed with stage 2 chronic kidney disease 4 years earlier. Her nephrologist had her on a carefully managed protocol: low sodium diet, adequate hydration, blood pressure medication, ACE inhibitor to protect the kidneys specifically. Her creatinine numbers had been slowly climbing despite perfect compliance. Despite doing everything right, despite never missing a dose or a dietary restriction. Her nephrologist called it progressive chronic kidney disease, a natural deterioration. Expected in someone her age? What her nephrologist had never asked about were the other things Caroline had been experiencing over the same 4 years. The sleep that had become fragmented and unrefreshing, waking most nights between 2 and 4 in the morning and lying awake for an hour before drifting off again. The brain fog that had arrived so gradually, she had stopped noticing it until her daughter mentioned that she seemed slower. The word retrieval difficulty she had started hiding in conversations. The low-grade anxiety that had settled over her like a permanent weather pattern with no obvious source. 4 years, 4 symptoms, 4 separate explanations from 4 separate appointments, and not one physician who had ever asked whether the organ coordinating kidney function and sleep regulation and cognitive performance and anxiety response might be the thread connecting all of them. Here is what the research shows about the brain and kidney function that the standard nephrology workup is not designed to assess. There are 5 specific mechanisms through which a deteriorating brain directly drives kidney damage in adults over 60. Each one represents a failure point that no ACE inhibitor and no dietary restriction is designed to address. Each one is addressable in ways that the standard nephrology protocol is not reaching. Mechanism number 1. The renin-angiotensin aldosterone system and the brain's secret kidney lever. The renin-angiotensin aldosterone system is the primary hormonal cascade regulating kidney function, fluid balance, and blood pressure throughout the body. Your nephrologist is almost certainly managing your kidney disease partly through this system, using ACE inhibitors or ARBs to reduce the strain on your renal filtration units. What is almost never explained to patients is that the renin-angiotensin-aldosterone system has a parallel component that operates entirely within the brain itself. The brain has its own local version of this system that directly regulates kidney function through neural pathways independent of the peripheral hormonal cascade your medication is targeting. When the brain's local renin-angiotensin system becomes dysregulated due to neuroinflammation, cognitive deterioration, or chronic sleep disruption, it drives inappropriate activation of the peripheral system in ways that your ACE inhibitor cannot fully counteract. Your medication is blocking one pathway. The brain is driving kidney stress through another pathway simultaneously that the medication was never designed to touch. A 2020 study published in the Journal of the American Society of Nephrology found that central nervous system renin-angiotensin dysregulation was a significant independent contributor to progressive kidney disease in adults over 65, and that treatment protocols targeting only the peripheral system were structurally incomplete for this population. Structurally incomplete for the population that most kidney disease medication is prescribed to. Mechanism number 2, neuroinflammation and the destruction of renal microvasculature. The kidneys are extraordinarily vascular organs. The glomeruli, the tiny filtration units inside each kidney, are essentially microscopic networks of capillaries through which your blood is filtered under precise pressure. These capillaries are among the most vulnerable structures in your entire body to the effects of systemic inflammation. When neuroinflammation, the chronic low-grade inflammatory process driven by microglial activation in the deteriorating brain, releases inflammatory cytokines into the systemic circulation, those cytokines travel to the walls of the glomerular capillaries. They trigger endothelial inflammation. They increase capillary permeability. They disrupt the precise filtration pressure that healthy glomeruli maintain, and they accelerate the scarring process called glomerulosclerosis that permanently destroys kidney filtration capacity. Your nephrologist sees the declining GFR, the falling glomerular filtration rate, and attributes it to the natural progression of chronic kidney disease. The inflammatory signal driving that decline originated in the brain. A 2022 meta-analysis published in Kidney International found that systemic inflammatory markers associated with central nervous system inflammation were independently predictive of GFR decline in adults over 60, regardless of traditional kidney disease risk factors. Independently predictive, meaning even when diabetes, hypertension, and medication compliance were fully accounted for, brain-driven inflammation was still accelerating kidney destruction. It was not being measured. It was not being treated. It was progressing unchecked while the nephrologist adjusted the ACE inhibitor dose. Mechanism number 3, sleep fragmentation and overnight kidney destruction. This is the mechanism that most consistently surprises people when they understand how directly it connects to kidney function. Your kidneys do not work at a constant rate 24 hours a day. They follow a precise circadian rhythm governed directly by the brain's suprachiasmatic nucleus, the biological clock that coordinates all circadian biological processes throughout the body. During deep sleep, your kidneys reduce their filtration rate significantly, allowing the glomeruli to rest and repair. Blood flow to the kidneys is redistributed. Inflammatory processes within the renal tissue are suppressed, and the renin-angiotensin system enters a lower activity state that reduces the mechanical stress on glomerular structures. When sleep is fragmented, when deep, slow-wave sleep is chronically absent, as it so commonly is in adults over 60 with any degree of brain aging, the kidneys never get their overnight rest and repair cycle. They filter continuously at elevated rates. The glomerular structures that should be resting are working. The inflammatory suppression that should be occurring is not occurring. And the cumulative effect of hundreds of nights of missed kidney recovery is measurable, progressive, irreversible kidney damage that presents in a nephrology appointment as unexplained GFR decline in a patient with good medication compliance and a careful diet. Caroline was waking between 2 and 4 every morning for 4 years. 4 years of her kidneys never completing their overnight repair cycle. 4 years of glomerular stress that her ACE inhibitor could not compensate for because it was not a medication problem. It was a sleep problem. It was a brain problem. A 2021 study published in the Clinical Journal of the American Society of Nephrology found that sleep fragmentation and non-restorative sleep patterns in adults over 65 were independently associated with a 43% acceleration variation in GFR decline compared to age-matched peers with normal sleep architecture, 43% faster kidney deterioration from a sleep pattern driven by brain aging that her nephrologist never once asked about. Mechanism number 4, cortisol dysregulation and chronic renal vasoconstriction. When the brain's stress regulation system, the hypothalamic pituitary adrenal axis, becomes miscalibrated due to neurological deterioration, it produces a pattern of chronically elevated or dysregulated cortisol that has direct and devastating effects on kidney function. Cortisol at chronically elevated levels drives persistent vasoconstriction of the afferent arterioles, the blood vessels that supply each glomerulus. When those arterioles are chronically constricted, the glomeruli receive reduced blood flow. The kidneys compensate by activating the renin-angiotensin system to raise filtration pressure. This compensatory pressure increase, maintained over months and years, physically damages the glomerular membrane. It is the same mechanism by which uncontrolled hypertension destroys kidney function. Except in this case, the pressure is being driven not by primary hypertension, but by cortisol dysregulation originating in a miscalibrated brain stress response. Your blood pressure medication partially addresses the resulting pressure. The cortisol dysregulation driving it remains untouched. Caroline's low-grade anxiety that had settled over her with no obvious source was not a psychological condition requiring antidepressants. It was the subjective experience of a chronically dysregulated HPA axis producing cortisol patterns her brain could no longer properly regulate. And those cortisol patterns were squeezing her glomerular arterioles every day while her nephrologist adjusted her dietary protein intake. Mechanism number 5. Autonomic nervous system failure and loss of renal autoregulation. Your kidneys have a remarkable self-protective mechanism called renal autoregulation. When systemic blood pressure fluctuates, which it does constantly throughout the day, the kidneys automatically adjust the resistance of their incoming blood vessels to maintain stable glomerular filtration pressure regardless of what is happening systemically. This autoregulation is governed by the autonomic nervous system, specifically by the sympathetic and parasympathetic signals that your brain sends continuously to the renal vasculature. In a healthy brain, this autoregulation is precise and rapid. Your kidneys maintain stable filtration pressure across a wide range of systemic blood pressure fluctuations. When the autonomic regulatory centers in the brain deteriorate, the precision of those signals is lost. Renal autoregulation fails. The kidneys become directly exposed to systemic blood pressure fluctuations they can no longer buffer. Every spike in blood pressure, every episode of labile hypertension, every morning surge as you stand up from bed translates directly into a spike in glomerular filtration pressure that the damaged autoregulation cannot smooth out. And each unsmoothed spike causes incremental physical damage to the glomerular membrane. Your nephrologist sees the damage. Your cardiologist sees the blood pressure fluctuations. Neither one is looking at the autonomic dysregulation in the brain that connects them. Type yes in the comments right now if your nephrologist has never once mentioned your brain in connection with your kidney disease. I read every single one. Here is what you can do about the brain side of your kidney disease that your current treatment is not reaching. These are 5 specific interventions that work at the neurological level of this problem. Intervention 1. Make deep sleep your most urgent medical priority for your kidneys, not for your brain. For your kidneys. Every night of quality, deep, slow-wave sleep gives your glomeruli a full repair cycle they are currently missing. 7 to 8 hours minimum with a consistent sleep and wake time every day. Bedroom temperature 60 to 67 degrees Fahrenheit because core body temperature drop is the primary trigger for slow-wave sleep initiation. No alcohol within 3 hours of bedtime because alcohol is one of the most effective suppressors of slow-wave sleep and simultaneously one of the most direct drivers of renal inflammatory stress. No screens 1 hour before bed. If your sleep fragmentation is severe, speak to your doctor specifically about sleep architecture evaluation, not just a question about whether you sleep enough. A formal assessment of whether your slow-wave sleep is occurring, because the quantity of sleep is not the same as the quality of sleep, and it is the quality that your kidneys depend on. Intervention 2. Reduce neuroinflammation through the specific dietary choices that protect your glomerular capillaries. Extra virgin olive oil as your primary cooking fat because oleocanthal directly suppresses the inflammatory cytokines attacking your glomerular endothelium. Fatty fish 2 to 3 times per week for EPA and DHA omega-3 fatty acids that reduce microglial activation and the systemic inflammatory load damaging your renal microvasculature. Deeply colored berries for anthocyanins that cross the blood-brain barrier and reduce the neuroinflammatory process at its source. Turmeric with black pepper daily. Reduce refined sugar aggressively because blood glucose spikes trigger both neuroinflammatory cascades and direct glomerular damage through advanced glycation end products. These are not general kidney diet recommendations. These are specific interventions targeting the brain-driven inflammatory mechanism destroying your glomeruli, while your low-protein diet addresses a completely different pathway. Intervention 3. 30 minutes of moderate aerobic exercise 5 days per week. For your brain first, for your kidneys as a direct consequence. Exercise reduces circulating neuroinflammatory cytokines. It improves autonomic nervous system function and restores the renal autoregulation your brain is currently failing to maintain. It reduces cortisol reactivity and improves HPA axis calibration, reducing the vasoconstriction, squeezing your glomerular arterioles. It improves sleep quality and restores the overnight kidney repair cycle your fragmented sleep is currently preventing. And it improves insulin sensitivity, reducing the blood glucose fluctuations that damage your glomerular membrane directly. Every single one of those effects addresses a mechanism driving your kidney disease from the brain side. Walk 30 minutes 5 days per week. For your kidneys, because your nephrologist has not told you to walk for this reason and this reason alone. Intervention 4. Address your cortisol load as a kidney protection strategy. Evidence-based approaches to cortisol reduction, including mindfulness-based stress reduction, Tai Chi, and consistent meaningful social engagement, are not soft lifestyle recommendations for older adults. They are direct renal protection interventions targeting the HPA axis dysregulation that is chronically constricting your glomerular arterioles. Multiple randomized controlled trials have shown that mindfulness-based stress reduction produces measurable reductions in cortisol and blood pressure in older adults with chronic kidney disease. The mechanism is the brain. The beneficiary is the kidney. Have this conversation with your nephrologist not as a wellness preference, but as a clinical intervention request. Intervention 5. Ask a different question at your next nephrology appointment. Not how are my numbers? Ask specifically whether your autonomic nervous system function has ever been evaluated in the context of your kidney disease. Ask whether your inflammatory markers, including interleukin-6 and high-sensitivity C-reactive protein, have been measured alongside your standard renal panel. Ask whether your sleep quality has ever been formally assessed in the context of your GFR decline. Ask whether a cognitive baseline assessment has ever been considered as part of your kidney disease management, given the published evidence linking brain aging to progressive kidney disease. These questions expand the frame of the investigation, and they position you as a patient who understands that the organ being treated and the organ driving the damage may not be the same organ. I want to close with this. Caroline, the retired librarian from Tucson, 4 years of perfect compliance. 4 years of a carefully managed protocol. 4 years of GFR numbers that kept dropping despite everything she did right. She eventually found a physician who asked about everything, who looked at her sleep, who measured her inflammatory markers, who ordered a cognitive baseline assessment alongside her standard renal panel. What they found was significant neuroinflammation, measurable sleep architecture disruption with virtually absent slow-wave sleep, and early autonomic dysregulation that was directly compromising her renal autoregulation. None of those findings were in her nephrology file. None had been looked for because nobody had thought to look. Her treatment changed that day, not because they gave her a stronger ACE inhibitor, because they finally looked in the right direction. Her GFR stabilized over the following 6 months for the first time in 4 years, not because her kidneys got better, because the brain that was destroying them started receiving the support it needed to stop sending the wrong instructions. Your kidneys are not failing because they are broken. They are failing because the system above them has been struggling for years and nobody looked up. The deterioration happening right now in your renal tissue is real, but so is the research showing that addressing the brain side of this equation meaningfully slows what the kidney side of treatment alone cannot stop. If this changed how you think about your kidney disease, please subscribe. This channel exists to show you what a rushed appointment never will. Share this with someone who has been told their kidney disease is simply progressing and there is nothing more to do. What you share today might be the thing that changes what happens at their next appointment. Leave a comment below. Type yes if your nephrologist has never once mentioned your brain. Tell me how long your numbers have been dropping. I read every single one. This is Dr. Angela Whitfield, and I will see you in the next one.